Volunteers for this video demonstration do not necessarily reflect some of the challenges that may arise during clinical scanning, such as body size or patients' ability to lie flat or position themselves for proper examination.
This is a guide to assessing the internal jugular vein to measure the jugular venous pressure as an approximation for the right atrial pressure. Jugular venous pressure at a threshold of 8 centimeters has a sensitivity of 80% and a specificity of 73% for the detection of volume overload. With the patient supine in bed, elevate the head of bed to 30 to 45 degrees and ask the patient to turn their head to the side, exposing the side of the neck. With the linear probe parallel to the floor, place the probe above the clavicle between the two bellies of the sternocleidomastoid muscle to identify the internal jugular vein. With the internal jugular vein identified, and with light pressure, follow the internal jugular up the neck until it tapers smaller than the adjacent carotid artery. The vertical height of this point is measured in centimeters from the sternal angle. Adding 5 centimeters to this measurement provides the jugular venous pressure. In this looped recording of an ultrasound of the neck, you can see the jugular vein, which is normally larger and more tortuous than the carotid artery, and you can see the jugular vein collapsing during inspiration. Once the carotid artery and jugular vein are identified, the probe is moved up the neck to find the point where the jugular vein and carotid artery are similar in diameter, with the jugular vein collapsing during the respiratory cycle.